Welcome to 7 West. We want your experience here to be safe and smooth, just like your road to recovery. In this video, you will see how we work together as a team to prevent falls and show you how to protect yourself.
About 11,000 fatal falls occur each year in hospitals. Injuries related to falls can keep you in the hospital for an average of up to 6 additional days. About 85% of falls occur during the evening or at nighttime. Chemotherapy or other medications given for nausea or pain can increase your risk for falls. Falls happen to people of all ages, but the average age is around 63 years old. If you are a fall risk, we will be placing this yellow and black sign outside of your room. This helps staff easily identify that you may need some extra help or more observation while you are here. Notice that you cannot have your windows completely covered so that we are able to see in your room for your safety. Once identified as a fall risk, we will place this sign under your TV in your room to remind you to use the call light. A verbal contract will also be made that you will call us each time that you get out of bed. Nurse-to-nurse bedside report will occur at every shift change and will include pointing out any of your fall risks at that time. We will be assessing your fall risk factors on every shift. Fall risk factors include a fall within the last 6 months, a change in your mental status like confusion, balance or gait issues, using a walker, cane, or wheelchair, sensory issues like impaired vision, numbness in your feet, or neuropathies, or any medications given that may make you go to the bathroom, make you drowsy, weak, or lightheaded. On admission, we will review the fall education handout, which is located on the education rings in your room. We will also have you perform a fall risk survey where we will have you answer questions to get an idea of your fall risk factors. We will keep this fall communication board updated and also post a fall prevention goal on your dry erase board if you are at risk for falls. We will be charting right outside of your room or at the bedside if necessary. We will check in on you hourly, and while you're in the shower or the bathroom, you may see us rounding on you more frequently. At times, we may need to accompany you to the bathroom for your safety. Physical therapy will be working with you to promote strength, and we want you to walk as much as possible. Most likely, you will see the physical therapist or the physical therapist tech stop by your room to encourage you to walk the halls or at least do some type of activity in your room.
Good morning. Ready for your walk?
When you do get up and walk, we may have you use a walker or a gait belt for your safety. If you leave the unit for a test or another procedure, we will have you travel by stretcher and give report to the transporter that you have some fall risk factors. As much as we try to prevent falls on our unit, they do happen at times. Here are some examples of how to get help if this unfortunately happens while you are here. If you fall and are alone in your room, we want you to safely try and call for help. If you can reach the call light, try to pull it out of the wall. This will immediately alert staff and we will be in your room right away. If you are alone and not near the call light, we want you to try and yell for help. We do not want you to injure yourself by trying to move closer to the call light. Only do this if it is necessary. If you are in the bathroom, please pull the red cord next to the toilet or the shower as shown here. This will also immediately alert staff and help will be on the way. Family members, friends, and visitors. If you are in the room and the patient falls, please pull the collet out of the wall or hit the staff assist button. This is a large red button that is located on the wall behind the head of the bed. This will sound an alarm and staff will quickly arrive to your room to help you. You can also pull the toilet or the shower pull cords like I mentioned before. Before you get up, we will make sure that you are wearing shoes or the skidded socks that we provide to prevent you from slipping. We will help you, but please make sure that the pathway to and from the bathroom is free of any clutter. Keep your personal items close to you, especially at night. Call us if you need any help, and feel free to use the specific button on the call light if you need to get up to the bathroom. Be sure to change positions slowly and use the side rails on your bed. Remember, there are also several handrails in the bathroom for you to use and a shower chair for you to sit on. There are also several handrails throughout the hallways if you need them as well. When you walk in the halls, it is always best to have a walking buddy. You can have a family member, friend, or one of our staff members walk with you if you need us. It's also a good idea to keep a nightlight on when it's dark in your room. Finally, we can set up a commode in your room if you are frequently getting up and down to the bathroom, especially at nighttime. We are your 7 West family, and we want you to have a safe road to recovery. We hope you found this video informative. Just remember one last thing.
Stay out of the danger zone.
Call, don't fall! We want your experience here to be safe and smooth, just like your road to recovery. Then I get stuck.
Fix your hair, Kim.
This video will provide information on blah blah blah.
Oh my God. I'm giving you a time limit.
Alright, let's start over.
Why are you laughing at? Because I'm on the wrong side of the room.
When you leave the unit.
Can you put the rail down? Someone put the rail down.
Don't enter the danger.
Don't enter the danger zone.
Call, don't fall!
Don't enter the danger zone.
Call, don't fall!
Wait, stop.
Welcome to 7 West. We want your experience to be safe and sound. Back up. Welcome to 7 West. Why? Get back. Safe and smooth, just like the road to your recovery. I think I meant to say smooth and safe. Or did I mean to say safe and smooth?
Safe and smooth.
Take 5. 5, 4.
Stay out of the danger zone.
Call, don't fall!